Hello, everyone. In today's lecture, we are going to discuss one of the most important concepts in digital orthodontics, that is the STL file. Now, every clear aligner treatment begins with an accurate digital scan, but that scan becomes clinically useful only after it is converted into a STL file. Whether you are using an intraoral scanner, 3D printer, or a treatment planning software, understanding STL file is essential. So in this lecture, we are going to cover what exactly is an STL file, the history of STL files, how an STL file is created, components of an STL file, applications in dentistry, advantages and limitations, common errors, and clinical tips. So coming to what exactly is an STL file, STL stands for Standard Tessellation Language, although it is also commonly referred to as a Standard Triangle Language. It is most widely used file format for 3D printing and digital dentistry. An STL file represents only the surface geometry of a three-dimensional object instead of storing curves of solid shape. It divides the object's surface into thousands of tiny interconnected triangles. Now, these triangles collectively reproduce the exact shape of the object, or in our case, teeth and surrounding structures. And the greater the number of triangles, the smoother and more accurate the digital model becomes. However, a large number of triangles also increase the file size. Unlike photographs, STL files do not store color, texture, patient's photograph, or internal anatomy. They only contain the external shape of the scanned object. So how did it all start? So there's a brief history of STL files. The STL files format was developed in 1987 by 3D System, one of the pioneers in the field of stereolithography. Originally, the STL files were created for industrial manufacturing to communicate with the 3D printers. As digital technology entered dentistry, the STL files became the universal language for exchanging digital models between scanners, CAD softwares, and laboratories and printers. Today, almost every intraoral scanner, CAD CAM softwares, and 3D printers support the STL files, making them the standard file format in digital orthodontics. Now, how is it created? So, the process begins with the intraoral scanner. The scanner captures thousands of overlapping images while moving around the patient's teeth. The sophisticated software stitches these images together to create a complete three-dimensional digital model. Once the scan is complete, the software converts this model into a STL file, and before exploring the clinical clinician should inspect the digital model for missing areas, holes, distortions, saliva artifacts, and stitching errors. Remember that an inaccurate scan produces an inaccurate STL file, which ultimately affects the fit of the aligner. So it is important that the uh, digital impression should be, or the scan should be, carefully inspected before it is converted into an STL file. Then, although the STL file appears as a single digital model, it is composed of several important elements. These components or elements are the thousands of the triangular facets, vertices that define the each triangle, surface mesh, normal vectors, which indicate the direction of the surface, and coordinates data, that is the x, y, and z axis. Now, unlike other formats, the STL files do not include the color, texture, material properties, and patient's information. They simply Their simplicity makes them compatible with nearly all digital dental systems. The main application in dentistry is in orthodontics, the clear aligner treatment planning, and digital study models, retainer fabrications, and indirect bonding trays. In implant dentistry, STL files are combined with CBCT data to design surgical guides, and in prosthodontics, they are used for crown, bridge veneers, and dentures. STL files also play an important role in digital smile design, occlusal splints, mouth guards, 3D printed models, and orthodontic surgery planning. Now, without STL files, modern digital workflow would not be possible. Uh, Let us see what are the advantages and limitations of the STL file. Mm, STL files offer several advantages. First, they are highly accurate and universally accepted, easy to transfer electronically, and are compatible with almost every 3D printer and CAD software. They eliminate the need for physical plaster models and allow clinicians to store patients' record digitally for years without distortion. However, still files also have some limitations. They only record the surface anatomy and cannot display internal structures such as the roots or bones, and they also do not include color information or the soft tissue textures for implant planning or surgical procedures. The STL files are often combined with CBCT images to obtain complete anatomical information. There are certain problems that can be encountered when taking a making a STL file. That is, the common problems include are the missing scan areas, holes in the digital model, saliva contamination, motion artifacts, and stitching errors, distorted surfaces, incomplete byte registration. So, as we all already discussed, that the clinical tip is that you keep the teeth dry before taking a scan, intraoral scan. Follow the consistent scanning sequence, rescan any missing areas immediately, and ensure proper byte registration. Verify the final model before sending it to the laboratory. So one should keep in mind that an accurate scan will result in an accurate STL file. So that is going to be converted into an accurate printed model, and if the model is accurate, then only we can get an accurate clear aligner. So STL is the standard file format used in digital dentistry, and it represents a surface geometry of teeth using thousands of triangles. The STL files are created from intraoral scans, and they are used for clear analysis, 3D printing, CAD CAM restorations, and digital treatment planning. High quality STL files are essential for predictable orthodontic outcomes. So that's it. Hopefully, the lecture was of use to you. Thank you.